Can you relate to this? You're tired and away, sleep doesn't fix. Your drive is gone, at work, at home, in every sense of the word. You put in the same effort at the gym, but feel like you're getting less back. And you're not as relaxed. You're shorter with people that you love, and you just don't feel like yourself. So, what did you do? You did what a lot of men do. You typed your symptoms into a search bar, and somewhere between the ads, you found a website ready to ship testosterone in about 10 minutes. But before you click that button, give me 10 minutes because those symptoms are real, they deserve to be taken seriously, and the answer may not be the one that website is selling. My name is Dr. Lola Ashaye. I am a board certified family medicine and lifestyle medicine physician and founder of InTouch Primary Care in Sugar Land, Texas. And I specialize in primary, preventative, and menopause care. And I help men and women finally get real answers about what's happening in their bodies. So let's get into it. This whole series, we've been talking about midlife, and a lot of the conversation has centered on women. And today I want to talk about the other half of the population because men go through their own midlife shift as well, and almost nobody sits down and explains it to them. So this is a scenario that a version that I see. Let's call this person Marcus. He's 48. He works hard. He provides for everyone. He hasn't had a real physical in years because there's no time. And over the last year or so, something shifted. He wakes up tired now. No matter how long he's been sleeping, he just feels tired. His wife mentions he snores, and sometimes he seems to stop breathing while he's sleeping. He's at the gym doing what he's always done, but now his strength isn't there, and his midsection has changed. He's foggy in meetings, he's flat in the way that is not like him, and his interest in intimacy has disappeared. And when he catches his reflection, he thinks he looks older than he feels. He's tired around the eyes, he's worn down. He mentioned it once briefly at a rushed visit with a doctor, and he was told he looked fine for his age and he should just try to get more rest. So he just kind of, left it alone. But Marcus did his own research and found a website that will send him testosterone after a short online questionnaire. And honestly, I understand why that is so tempting. He's been dismissed, he feels terrible, and someone is finally offering him something. But here is something that every man needs to understand. And this is genuinely different from what most of those websites will tell you. There is no true male menopause. In women, menopause transition is a relatively defined event. The ovaries wind down over a period of years and then the periods stop. In men, it's nothing like that. Testosterone tends to drift down slowly and gradually from around 30s onward, roughly 1% a year for many men. So there's no cliff, there's no shift. So male menopause is really a marketing phrase, not a medical event. But symptoms are real. They're just not, they're not specific. There's fatigue, low libido, irritability, losing strength, changes in how your body holds weight, poor sleep. Every one of those is real, and every one of them can be caused by low testosterone or by half a dozen other things. So the whole problem, you need to kind of take all of it together. And that's why the job is finding out what else is going on. And this, websites that offer testosterone skip all of that. So one of the things that could be happening is sleep apnea, which is very, very common, thyroid problems, low iron, blood sugar issues, depression, chronic stress, medication side effects. There are many things that can cause similar symptoms, and those conditions can also lower your testosterone. So treating sleep apnea on its own can often increase the level. And if we do tests, it has to be done properly. A real diagnosis isn't a random afternoon blood draw or mall order kit. It needs to be symptoms plus low levels confirmed on 2 separate morning tests during fasting, because testosterone naturally peaks in the morning and fluctuates. So if the level is truly low, the next question is why? Because that answer changes what we do next. So here's the picture. In a large study done recently, they followed more than 5,000 men with low testosterone and high cardiovascular risk, and they found that testosterone therapy did not increase the risk of heart disease. Based on that, in February of 2025, the FDA actually removed the heart disease warning from the testosterone products, which is great. But notice that the FDA kept testosterone is still not approved for low levels caused simply by aging, because the trial also flagged higher rates of blood clots in the lungs and atrial fibrillation, and there are also blood pressure consideration. Also, it's important to know that testosterone suppresses sperm production, which is really important if you're still trying to have children. So this is a real medication with real trade-offs. So it's important to understand the risk and the benefit. So let me pause here because I know there are some people that need to hear this that are not going to be looking for this. So men are far less likely to bring this up, far more likely to just power through until something breaks. So if there's a man in your life who's been running on empty, calling it normal, please send this to him. And if that man is you, please send to a friend who you know probably is doing the same thing. That's really a way you can really help. So you've heard that maybe isn't low testosterone just a made-up marketing term? Well, two things are true at once here. There is something called genuine testosterone deficiency, and it's a real medical condition with real treatment. And that part is not made up. What is marketed is there's an industry built around handing testosterone to any man who feels tired without really checking why. So being skeptical of ads is smart. Dismissing your symptoms entirely is not. Some people might think it's just change, it's just aging, right? And yes, gradually as time goes on, your testosterone just does reduce, but you don't have to accept being tired all the time and not being able to function. There are other things like sleep apnea, blood sugar problems, thyroid issues that are worth checking for, and that's important to get tested. And the test online, a questionnaire online, typically can't do that. The other thing to consider is that if it's apnea and you just treat it with testosterone, you haven't fixed anything. The testosterone can actually make untreated sleep apnea worse. You will need ongoing monitoring once you start, and that's the easy part. Doing it safely is the part that requires a physician who knows your full picture. So what if your levels come back low? Shouldn't I just start testosterone? Maybe, but maybe not automatically, and not before you ask why it's low. Sometimes the answer is treating something else entirely and watching the level recover on its own. And if therapy is the right call, that's a conversation about the risk, benefits, your fertility plans, and all of that needs to be had before just starting. So something I hear is, I just don't have time for this. I hear that constantly, and it's usually with men that are very busy, they're carrying a lot. But this is just a few hours of your life to sort out something that's affecting every one of your days. Your energy, your work, your patients, your family. That's not time away from the people you're taking care of. It's part of taking care of them. So here's what I'll leave you with. You don't need a website to sell you a shortcut. You need someone with time to actually figure out what's going on, to look at your sleep, to look at your labs, your history, your goals, and to tell you the truth about what you're dealing with. That's really important. That's the kind of care built in InTouch Primary Care, and that's what we provide. As a direct primary care practice, we have unhurried visits, no copays or deductibles, which matters here because sorting this out properly usually takes more than one conversation and often more than one test. Many common medications are included in our membership, and those that aren't are available at wholesale pricing, along with wholesale pricing on labs and imaging. So getting real answers doesn't have to be a mystery bill. And I'm also licensed in several states, so for many patients, a good deal of this can happen through telehealth. So if you've been powering through and calling it normal, let's find out what's actually going on. You can do this by booking a free 15-minute consult at intouchprimarycare.com. The link is also in the description. And as always, remember, this video is for general education. It's not medical advice about your specific situation. It's a conversation, that's a conversation you'll have to have with your own physician. But I want you to imagine this. Imagine you're sleeping through the night, you're actually waking up rested, you're finding out the reason you weren't, that something was, fixable all along. Imagine your strength is back, your focus is back, your patience is back, and you really know what's going on with your body now instead of guessing. That's the kind of clarity that is available to you. It just takes someone with the time to look properly at what's going on. So I hope that helps, and I'll see you at the next one.